Thank you so much for joining us today on another edition of Extreme Health Radio. I hope you're having an amazing day, whatever you're doing. I thank you again for joining us. We have a great show for you planned today with Dr. Gerald Smith, who's a biological dentist out of Pennsylvania, I believe. And I just want to let you know that we are broadcasting worldwide from Southern California, and we do about 3 shows per week. Today is Friday, October 5th, 2012. Time is flying by, and this is episode number 17, so you can find it at extremehealthradio.com/17. And just to let you know, all of our shows are transcribed and there are show notes. So if you're ever going to do a search on our website, please take advantage of that. Anything a guest says or I say during an interview is searchable on our website. So please take advantage of that. And if you have any questions for our guests, you can email them to Justin at extremehealthradio.com, or you could call our voicemail line 949-391-7363, and I'll play your message for our guest on the air. And this show is brought to you by the Vitamix Blender, and you can find that at extremehealthradio.com/Vitamix. If you buy it through us, we'll get a little commission that will help to further our efforts, and we greatly appreciate that. Before we introduce our guest, I want to just talk about our show schedule. As I said, we do about 3 shows a week. We've got some exciting guests coming up. Dr. Bob Marshall out of Austin, Texas. He's got a cure for just about everything. He's an incredible doctor, and I highly recommend you check out that show. We've got Dr. Charles Partito, creator of the Ejuva Cleanse, talking about colon health, how to keep a healthy bowel, and cleansing and detoxification. We've got Nina Silver, who's a prolific author and has written extensively on energy medicine. And so I strongly suggest you take a look or listen to that show. And so let me introduce our guest today. I'm very, very excited to have Dr. Gerald Smith. He is certified by the World Organization for Natural Medicine to practice natural medicine globally. He's also a certified dental practitioner. His broad base of postgraduate training in dentistry and natural medicine enabled him to integrate many healthcare specialties to his patients. And he's also a night hospitaller, so we'll have to ask him about that. And he's lectured at the Walter Reed Army Medical Center, National Academy of General Dentistry, and at the Academy of Head, Neck, and Facial Pain. And he's given dozens of guest lecture appearances on national and international symposia. He's a member of the International Association for Orthodontics. And he's quite a prolific author as well. He's written the books on called Headaches Aren't Forever, a newly published on CD-ROM, Alternative Treatments for Conquering Chronic Pain. And one that I'm interested in is Reversing Cancer, a Survivor's Guide for Understanding the Nature of Cancer. And he's head of the International Center for Nutritional Research, and he runs ICNR.com. Wow. So thank you so much, Doctor, for taking your time out of your day to talk to us today. We really, really appreciate that.
Oh, it's my pleasure.
Excellent. So you're based out of Pennsylvania?
Correct. Outside of Philadelphia, Pennsylvania, near Trenton, New Jersey, and Langhorne, actually.
So did you start out as a conventional dentist, or did you start out more on the natural side?
Conventional. Basically, I did my regular training in Temple Dental School, graduated in '69, and then spent 2 years in the service. But what was interesting, my turning point was getting involved in a study group that had chiropractors, medical doctors, physical therapists, dentists, oral surgeons, and orthodontists. And that's how I kind of was exposed to a whole new horizon of information here.
Wow. And so when you see that there's cures for things that conventional dentists aren't seeing, it kind of opens up the world to you, doesn't it?
Well, it opens up the world, but it's also scary that here I'm this little speck of sand on a beach, and I flipped the rocks and found many direct combinations or connections to major diseases, and yet the establishment is still blind to these things.
Wow, it's interesting. So so you're still practicing dentistry? That's correct?
Correct.
Okay. And so you still see patients, and you see patients for many other issues other than just, problems with their teeth, obviously.
Correct. Well, I have a Doctor of Natural Medicine degree, so that gives me a license to expand my therapy to a whole new high area of treatment because under your dental license, you're restricted.
Mm-hmm. Right. And so, so you're treating people with things like, people come to you for all kinds of different things and, like cancer and everything under the sun. Correct.
I mean, we have some pretty interesting cases. Just to give you an example, we had a patient with stage 4 throat cancer. And when he told his oncologist that he was going to go for alternative, the oncologist said it's a farce. Anyway, when I examined the patient, he had 3 infected teeth. Uh-huh. 2 of them were root canals and 1 was a regular tooth, but the roots were infected. But yet, overtly, there was no pain, swelling, or other symptomatology. So when I tested him using quantum techniques, which is based on energy medicine, mm-hmm. the same pathogens or viruses or bugs that were in the teeth were in the throat cancer area. And I extracted the teeth, put ozone in the jawbone, homeopathics and ionic silver, placed the patient on a raw food diet, mm-hmm. Raw juices, Rife technology, and he was seeing a medical doctor for insulin potentiation therapy. And Justin, in 3 weeks, the cancer was totally gone.
And this was a stage 4 or stage 3 throat cancer?
Stage 4 cancer, yes.
I'm sorry, you cut out once. It was stage 4 throat cancer, you said.
Correct.
That is unbelievable. So when you talk to, I'm sure you're chummy with, other, conventional doctors. When you talk to these types of people and they ask you, some of the things that you're working on and some of the results that you're getting, what do they say when you tell them about these things?
Well, it kind of blows their circuits for the simple reason that they're afraid to use the technology because there's basically like a witch hunt mm-hmm. that they don't want alternative methods to be widely publicized. And plus the fact the hospitals won't let the physicians use the technology. I mean, a perfect example, my dad had congestive heart failure and I kept him alive for 13 years. And he was in an experimental group. And the pharmaceutical company that was making the drugs, when I called them, I said, what's the life expectancy on your drugs? And they said 2 years. Well, 4 years later, my dad was the only one alive out of the experimental group. And I said to his cardiologist, don't you want to know what I had my dad on? He said, no.
Really?
Yeah, they don't want to know. Because they can't use vitamins in the hospital, they'll throw them off the staff.
Yeah, and so what's the point even exploring that, right? I mean, it's not within the what do you call it? The standard of care.
Standard of care, right?
Yeah.
That's how they nail you. They'll say you're practicing below the standard of care, when in actuality you're above the standard of care.
Yeah, that standard of care is just, it's almost frightening as in terms of what, how people have to stick to that, isn't it?
Well, it protects the lowest man on the totem pole. Mm-hmm. Or putting it bluntly, the dumbest doctor on the totem pole.
So if someone had an acute disease, like, something wrong with their heart or something wrong with maybe some kind of cancer, would the first place that you look when they come in, would that be the jaw or would it be something else?
No, the whole mouth complex.
Okay.
70 to 90% of all medical problems have their origin in the mouth.
70 to 90%?
90%. Correct.
Oh my gosh. And I would imagine barely anybody knows that.
Well, there's a handful of people, but I teach a residency program up in Toronto to educate professionals on this whole dental, whole body connection. Mm-hmm. Because once you see it, it's like anything else. The closer you get to the truth, the more simplistic the solution is.
Yeah. We had Dr. Bruce Shelton on from Arizona a few days back, and he was saying that there's only about, I think, a little over 100 truly biological dentists in the United States. Is it really that small? Correct.
Like I said, most healthcare practitioners are insecure and fearful of the dental boards, the medical boards. I mean, I just beat the dental board after about a 3-year battle mm-hmm. On my appeal. And they're just brain dead. They have no clue what's going on. And, they're after, they want to make examples of healthcare practitioners to send a shot across the bow to keep the fear level up.
Mm-hmm. Yeah, that makes sense. So a lot of people have been talking about and interested in, the role of root canals. Can you tell me why, or tell our listeners why root canals are so darn taxing on the body and so dangerous?
Well, you have to understand that we're the only profession that embalms an organ and keeps it into the body. So you're talking about a dead organ.
Mm-hmm.
When, excuse me, when the nerve dies, you get breakdown products of protein, some of which are thioethers, which are related to mustard gas. Plus the fact, when you have a tooth that died, there's a reason for it. There could have been trauma, but more than likely there was some infection within the tooth that got to the nerve that caused it to become necrotic or dead. Those bacteria live in the little dental tubules. Mm-hmm. To give you an example, Justin, a molar tooth has approximately 3 miles of dental tubules. They're 4 microns in diameter, which is like minuscule. Mm-hmm. And these bacteria live in there, and they pump out their poisons. And these poisons literally get into the lymphatic system and get carried away to the thyroid, the thymus, the heart, and the rest of the body.
And so it's true that, each tooth corresponds with a different organ in the body. I think there's some truth to that, right?
Well, yes, embryologically, the teeth develop from the same cells as the autonomic nervous system. So to give you an example, your front teeth, the canine, develop from the neural tube when the fetus is growing, which gives rise to the same sympathetic nervous system. Mm-hmm. Your posterior teeth, your bicuspids back to your wisdom teeth, develop from neural crest cells, which is your parasympathetic. And it was Reinhold Voll in the 50s. He was a German, East German physician that linked the different teeth to different organs.
Wow, that's so amazing. So if someone's out there that has or is looking to get a root canal, what would you suggest they do?
Well, under certain circumstances, I'll do a root canal. Uh-huh. And by that I mean that there's no large infection, and the pulp had recently died, and we use ozone in the canals. We test all the materials in the canals mm-hmm. so that they're biocompatible. And because here you're caught between a rock and a hard place. If you lose posterior support, you lose stability to the cranial sacral system. Mm-hmm. But there's ways of kind of cleaning the area. I have 2 root canals in my own head, mm-hmm. and I use the Rife technology. It's RIFE. Mm-hmm. Like once a week prophylactically, just to keep any infections or problems, down to a bare minimum.
Mm-hmm. So now on the root canals, I have one now, and I'm looking to do something with it in terms of fixing it, because I had mine done before I knew better down in Mexico. God only knows the kind of equipment they were using down there, and so some people say you should pull the tooth. Is that something that you think should be done? Well,
I'm very conservative, uh-huh. and I would strongly recommend having the tooth tested.
Okay.
There's any number of ways that you could do it. If, for example, thermography was used, mm-hmm. thermography delineates temperature changes, and if a hot spot or it's showing up red in the area where the root canal is visible, mm-hmm. then you know that there's inflammation going on there. You could also use, Voll technology or Indigo system or Avantar. There's so many different electronic diagnostic systems that could be used. Okay. And then using a muscle testing technique called direct resonance testing, where we have vials of specific frequencies of pathogens, and you can literally delineate what pathogens are present in the area of that root canal.
Okay. So now how does removing a tooth during, for a root canal, affect the proprioception of the jaw and the structural balance? How does it start affecting, if you remove a tooth, the overall balance of your jaw, your shoulders, your hips, and your knees, and all that kind of stuff?
Well, number one, you have the proprioceptors.
Okay.
Are taken out of the socket with the extraction. And number two, you're losing the physical contact to the opposing tooth.
Okay.
And that affects the cranial bone balance.
Okay. Oh, and so once your jaw is out of balance, then is it sort of like the slinky deal where it starts affecting the whole rest of your body? The whole rest of your body has to compensate. Is that correct?
Correct. You basically have 28 bones that make up the human skull.
Okay.
And they're joined together kind of like in areas what I refer to as like little zippers. They're sutures.
Uh-huh.
They're expansion contraction joints.
Okay.
When the forces become imbalanced, the sutures distort in their balance, which affects the dural membrane system within the cranium. And that dural membrane system passes through the base of the skull. It attaches to the upper 3 cervical vertebrae, and then it goes all the way down to your sacrum. So there's your slinky.
Right. I just shudder. I talk to people all the time, and they tell me, oh, I have to get a root canal, and they talk about it as if it's no big deal. And, some people know, that I know really well, know what I do, and they ask my opinion, but some people don't know what I do, and they just, say these things. And do you just shudder when people tell you these types of things and they act as if it's really just not a big deal?
Oh, absolutely. It's mind-boggling how the establishment has sensitized the population to accept disinformation. Mm-hmm. Back in the 30s, Weston Price, who was had impeccable credentials as a researcher for the American Dental Association, and they took infected teeth out of patients, put them under the skin of healthy rabbits, and the rabbits came down with the exact same disease that the patient had.
Wow. I've heard about that. I think there's something that I heard recently about some sort of toxin that the bacteria produce called propionic acid. And when a tooth is, extracted from someone who had autism, and, there was parts of that tooth that was injected in the rats, I think, and they started exuding, autistic behaviors. And it's just amazing that kind of research is going on, and yet no one knows about it.
Well, sure, because it smacks it right in the face of what the establishment is putting out, is that vaccines are safe, and mm-hmm. Chemicals are safe, and fluoride's safe. The bottom line is the average child today being born has, on average, 287 chemicals in its blood at birth. This was well documented by the Environmental Working Group. They spent $50,000 on each of 10 children, and they tested their blood by taking it out of the placenta at birth. And it's mind-boggling to think that you have this human fetus developing in a cesspool of chemicals for 9 months. They get out, then they want to inject them with a hepatitis B in a hospital when they're like hours old. It's off the wall.
When you start realizing all of this stuff, it just makes so much sense, doesn't it? Why people are getting sick, why there's autism, why there's cancer. I have a friend of mine who, I went to high school with, and she's got stage 3 colon cancer. I mean, it's just, if you don't really know what's going on, it seems as if these types of things are coming up out of the blue. But when you start understanding, like you were just saying, how we can't even live the first few days without being exposed to hundreds of toxins.
Well, it's one of the reasons why I wrote a book called Reversing Cancer, because my wife went through a stage 3 ovarian cancer, and I saw the intimidation techniques that the establishment uses to coerce people into chemo and radiation and all the invasive techniques. Mm-hmm. And I swear, I spent like 3 days in the hospital after my wife had surgery, and I was so disoriented from not being able to sleep with code 4 messages in the middle of the night. I could have been selling flowers at the airport. But the key here is that you have a multitude of factors that are, placed upon the individual on a daily basis. You have the radiation coming over from Fukushima. That's over a year ago, but every day we're getting inundated with radiation. And they're not talking about it on 11 o'clock news because they don't want the people, fearful. But there's nothing that they could do about it. But the establishment doesn't realize that with simple intake of iodine and a special nanizeolite product, you can negate the radiation effects.
Wow, that's amazing. We got to take a quick break, but when we come back, I want to ask you a lot more about the dental connection to diseases and cancer and things like that. So we'll be right back. We're with Dr. Gerald Smith. He is the head of ICNR.com, and he's also the creator of, I believe it's dentalwholebodyconnection.com, and we'll have all these links on our show page here. So we'll be right back with Dr. Gerald Smith. Hey there, I hope you're enjoying the show so far. I wanted to talk a little bit about tooth decay, and I'm not sure if you know this, but lots of biological dentists around the world that are on the cutting edge of research have made the connection between tooth decay, cavitations, and root canals to things like heart disease and cancer. And I'm not sure if your dentist has told you that, but the health of your mouth is critically important to your overall health. And there's a great book that teaches you how to reverse tooth decay, cavities, and eliminate tooth pain and root canals, stop cavities, and form new tooth enamel, something that your dentist probably has never heard about. It's called Cure Tooth Decay. You can check it out at extremehealthradio.com/decay. And if your dentist is currently trying to persuade you to get a root canal or to get your wisdom teeth taken out or anything like that, I strongly and highly suggest that you read this book. It's about $25, and it can change your life because the health of your mouth and the health of your gums and teeth is going to directly correlate to your overall health and your longevity. So the health of your teeth is a critical component to how long you live and whether or not you get disease. So you can check out this book. It's called Cure Tooth Decay at extremehealthradio.com/decay. And if you're interested in more products just like this, visit our store and you can check out all of the amazing products we have on there for you. All right, so let's get back to this interview. Okay, we're with Dr. Gerald Smith, the founder of ICNR in Pennsylvania. And Dr. Smith, I wanted to ask you too about staying along the lines of the tooth connection. We're trying to educate people in terms of the connection between our teeth health and disease and our overall health. So with the root canals and with things like the removal of wisdom teeth, are these things that, let's start with the removal of wisdom teeth. Theoretically, this shouldn't even be happening because we should have enough space in our jaw for our wisdom teeth, right?
Well, one of the problems that arise is if you go back to Weston Price and Francis Pottinger's research from back in the 30s, they discovered that within one generation of eating processed foods, white bread, white sugar, that type of thing, pasteurized milk and so forth, that the next generation, their jawbones became smaller because they didn't have the mineral content to enhance the development. So, the key is that you're getting these problems that are cropping up, and the dentist, it's a $1 billion industry of extracting wisdom teeth. So, you have a golden goose here. And if you look at the literature, a high percentage of these teeth, if left alone, will erupt. They start extracting, or I call them amputating them, age 16, 17. The jawbone is still developing. So the key here is that when they extract the tooth, they're not getting primary closure to the socket, and the bacteria are migrating from the mouth into the jawbone and living there for the rest of your life. In fact, my mentor, Dietrich Klinghardt, who's an MD, PhD, basically estimates that 90% of all wisdom tooth extraction sites are infected.
90%.
90%.
Well, that would make sense. I mean, you just can't, and using conventional methods, you can't get rid of bacteria. I mean, bacteria, is everywhere.
Well, the key is when I do an extraction, I don't do third molars, but if I do a regular tooth, basically you meticulously have to curette or scrape out the socket, and then we ozonate it using a medical machine that produces ozone, and that kills all kinds of pathogens, and then irrigating it with ionic silver, and then homeopathics, and then putting in a resorbable sponge called gel foam, and then suturing it up. Post-operatively, the patients have minimal to no pain after the surgery. And the pain is coming from the bacteria that are left or migrate into the canal, and the toxins they produce stimulate the pain receptors, the nerve endings. So the key is you can reduce dramatically the infection of that area.
It is possible, but not with conventional doctors.
Correct. I can give you two quick examples. We had a patient in from Seoul, Korea that had 10 years of congestive heart failure. And she went to all the top cardiologists, and no one could get to the core etiology of what was going on. And when she flew in and I tested her, she had a strep infection in the jawbone where a wisdom tooth was taken out 10 years ago. Once we got rid of the strep infection with nutrients and frequencies, the congestive heart failure completely disappeared. Another quick example was a patient who had emphysema on steroids for a year, and I tracked it down to a strep infection in the jawbone where a bicuspid tooth was taken out 15 years ago. Cleared up the jawbone infection, and the emphysema totally disappeared.
Wow, that is just so crazy that could be the case. I mean, it's just, it shows you that the body is truly an amazing organism. It's not just a machine, calories in, calories out. It's really interlocked and interlinked everywhere. And so now I have, before I knew any of this information, I had my 4 wisdom teeth taken out, I think around 2000, and I had a root canal. And so I would imagine that many people are in my boat. They might have 1 root canal or maybe 2 or more, and they've got other tooth issues like an extraction. So now with the 4 wisdom teeth that were taken out, it's pretty safe to say, I should say, that there are 4 cavitations there, right?
A very good chance.
And a cavitation is what?
Basically an infection in the jawbone.
Okay, and it produces no symptoms or anything, right?
Correct. There's no swelling, there's no pain, there's no pus, and that's the problem. It's insidious. It's a time bomb that's sitting there. And, my belief system is that everything is fine. It's like the guy who jumps off the Empire State Building and he's 12 stories down. He said, so far, so good. The key here is that under normal circumstances, when you're relatively young and healthy, your body can handle that. But it takes, one incident, a car accident or emotional trauma or a flu episode or a vaccination or whatever, that tips the scales.
So it sounds as if your immune system is sort of like a teeter-totter, and when something happens, that's dramatic or traumatic to you, these things like a cavitation or a wisdom tooth extraction, cavitations and root canals, these things just sort of sit on top of your immune system as if it's like a sumo wrestler, and it weighs down and bogs down the immune system. And when you're 20 years old, you have a strong immune system, so you don't feel it. But later on in life, when other things start happening, your immune system just can't work. Is that kind of how you're thinking of this? Absolutely. Interesting. Wow. So now, I know there are websites and places for people to find biological dentists, because I know people are going to be listening and they're going to be thinking, shoot, my doctor wants me to get a root canal. Where do I find a biological dentist? And do you have a resource for that on your website? We do, and there's a few organizations that they could check out. One is the Holistic Dental Association, and another group is the International Academy of Biological Dentists. Okay.
And then there's also IAOMT. It's International Academy of Oral Medicine and Toxicology. You also have DAMS, Defense Against Mercury Syndrome. So these are good groups that you're going to get information from that'll help you make a more informed consent.
Okay. And if I were to get something like this done, theoretically, would I feel anything? Because I know some people feel a radical shift in their body, sometimes for the better after they go through sort of a healing crisis. But, if someone were to get, 2 or 3 things done at one sitting, what would they feel afterwards?
Well, I can give you a few examples. We had one woman that had pain down the left side of her body, and it was exacerbated when she would play the piano. Mm-hmm. And her conventional dentist was treating an area on the lower left second molar that was abscessed. And he was telling her, food was just trapping in under the bridge and you had a periodontal or gum problem. Mm-hmm. Well, when I reviewed the radiographs or x-rays, she had a full-blown infection in the jawbone. And when I extracted the tooth and cleaned out the area with the ozone and homeopathics and ionic silver, the pain totally disappeared on the whole left side of the body.
Really?
Yeah, a lot of patients noticed energy changes. We had one patient that had a lot of mercury fillings in his mouth. Mm-hmm. And after the last restoration was taken out and replaced with biocompatible material, he couldn't believe the difference in his energy level. And he's been suffering since teenage years, and he's in his 40s.
Now, some of those biocompatible materials are substances like zirconium and things like that, right?
Correct. There's also resin materials, but literally, everyone is a chemical and energetic fingerprint, and you have to test to see compatibility. Okay. So this is an area that's unfortunately not being performed on a routine basis by many dentists. Mm-hmm.
Yeah, many dentists aren't doing blood samples and checking for biological compatibility, are they?
Correct.
Yeah, that makes sense. It's just too involved for their general practice, I would imagine.
Well, if you use cranial rhythm, which basically to me is the best lie detector in the world, because you have an aura around every patient. And if you take a substance that has an energy pattern and you place it into that aura, if it's compatible with that patient, the cranial rhythm remains balanced. So it's inexpensive, it's accurate, and it's quick.
Now, what is what is the cranial rhythm?
Okay, the human brain functions in an expansion-contraction mode to help pump the cerebrospinal fluid around the brain and the tissues. Okay. So even if you hold your breath, the brain will still open and close kind of like an umbrella. Okay. That is an energetic expansion-contraction function. Mm-hmm. When you take a substance and put it into their aura, which is an extension of the autonomic nervous system, the computer of the body picks up immediately whether it's good for the individual or bad for the individual. And it reflects in the motion of the skull.
And you could do a test to see the cranial rhythm.
You can feel it with your hands.
Interesting.
Yeah.
Yeah, this whole idea of the biofield, I know Dr. Marshall out of Austin, we're going to have him on this weekend. He talks a lot about the biofield, and it sounds like you're into the same types of things. I want to ask you a little bit about getting into this type of subject matter, about the Rife machine. And I think you sell those, if I'm correct.
Correct.
And
basically, the technology was developed in the 30s. And it was based on Rife's fabrication of a special microscope, the universal microscope that stained the pathogens with light. Okay. And that's how he would determine the mortal oscillatory frequency of the different pathogens.
The mortal oscillatory frequency. Okay.
Oscillatory. In other words, every virus, bacteria, fungi vibrates at a signature frequency.
Okay.
And when you bombard it with a similar frequency, it explodes it, and it doesn't damage the surrounding tissue.
So that would be similar to like something like a singer in a wine glass and shattering the wine glass. Is that kind of
Correct.
the idea? Okay.
Correct.
And so all of these viruses, and is there a list somewhere that you could find out what viruses resonate at which frequencies?
Oh, absolutely. If you go on the internet and do a search for rife frequencies, you'll find sites that provide the exact frequencies for each pathogen.
Now, is this similar to this type of stuff? Is just completely? I'm sure people listening probably have never heard of it, and I've known about it for quite a few years. But it's fascinating, and it blows my mind how things like this can work. My wife and I, a few years back, went to a doctor who had a Rife machine, and I believe it was a Rife machine. It might have been like some sort of biofeedback machine or something, but he had these two little circular areas in the device, and he was talking about how he could actually change the results and heal people with over long distances of area. So he was doing experiments with it and getting extraordinary results with people who weren't even near him. Is that?
Yeah, that's called subspace.
Subspace, and
yeah, basically
how does that work?
It locks onto your DNA code. It works because we have a similar instrumentation, and it's awesome technology. It's Star Wars. I mean, think about it. You have astronauts up in a capsule. Do you think that they're drawing blood up in space and giving them polypharmacy to cure them?
I guess no.
No, I don't think so, because one good barf up in the capsule is going to turn off his comrades.
Right. Wow. So is this, I've heard over the years that there's a lot of issues as far as the government is concerned. Is that true with the Rife technology? I've heard that, you can't even search for that without being logged by Google or whatever.
Probably.
Oh gosh.
Well, the bottom line is, just think about it. Back in 1934, Rife, under the auspices of, I think, which university was it? It was either Stanford or UCLA. I think it was UCLA. Mm-hmm. And they had top doctors that were monitoring the project. They had 16 terminally ill cancer patients. Mm-hmm. And in 130 days, they cured every one of them with the frequencies.
Say that again. 16
terminally ill cancer patients were treated with the frequencies for 130 days, and every one of them were cured of cancer.
Yeah, you cannot have that. If you're that has to be suppressed, right? I mean,
well, absolutely. Well, that's when it all hit the fan, because within the next year, 11 research centers around the country that were validating Rife's technology mysteriously burned down. Now, come on. I mean, that's not an accident.
Right. That is absolutely amazing. And the average person out there has never heard of a Rife machine?
Well, the name's been expunged. It's not in the books. The physicians are never exposed to this. Mm-hmm. And then when it is brought up, they make light of it and, like shock people and just, childish behavior to try to downplay the significance of this technology.
Yeah, I mean, it makes sense if you're, trying to hold on to your power. You want to make sure you suppress these types of things. And with Rife machines, I've heard that you can actually homeopathically imprint things, water, and put something into your water, and you can drink that every day for to cure diseases and things like that. Is that kind of how some people that have Rife machines in their home? Is that how they use them?
Well, it depends on how sophisticated of a unit that you have. Okay. Some units, like with our Indigo system, we can imprint water or imprint homeopathic and solve problems. Give an example. We had a patient from Chicago that had internal trembling for a year, and it was coming from Levaquin, which is a very nasty antibiotic.
Okay.
And so I had him bring in a Levaquin tablet. I dissolved it and imprinted it and made a homeopathic remedy from the drug. Okay. Within 24 hours, the internal trembling was totally gone.
Jeez, that's incredible. So you do homeopathy, or energy medicine, dentistry,
whatever it takes.
Yeah.
I'm one of these people that are a why person. I've been flipping rocks for well over 35 years. I've been practicing over 42 years. The key is the answers are out there, Justin. Mm-hmm. You just, as Edward de Bono, the great psychologist, said, you have to dig lateral holes to interconnect the dots. You can't keep digging the hole deeper and looking for the magic surgical procedure, the magic chiropractic adjustment, the magic drug or vitamin or whatever. It doesn't exist. You have to define the underlying core issue and then address it with the appropriate therapy.
Yeah, that makes so much more sense than, just the typical, conventional doctors and their aggressive treatments. But when we come back, I want to ask you some more questions about the Rife machine, as well as like gum disease and things like this, and what things people can use to brush with, and some of that self-care stuff that is practical information. So we're with Dr. Gerald Smith from ICNR.com and DentalWholeBodyConnection.com, and we'll be right back in just one moment. Hey there, I hope you're enjoying the show so far. I wanted to tell you about the best alternative cancer treatment book on the market today. It's called Cancer Step Outside the Box, and you can check that out at extremehealthradio.com/cancer. And it's written by Ty Bollinger, and we've had him on our show. He was our very first episode. He's written a prolific book on cancer, talking about all of the natural cancer treatments that are out there that are on the cutting edge. Some of them have a 93% success rate. He gives you inside the book, which is like 400 pages, he walks you through all of the natural cancer treatments that are the most effective. He's got all kinds of cutting edge research on why chemotherapy just does not work, how to heal the body, how to cleanse the body, many different ways of cleansing. And he's got entire protocols of all the most popular and powerful treatments to beat cancer. Some of them even in the stage 3 area. I highly recommend this book. If you know someone who has cancer, or if you've been diagnosed, please get this book. It's really incredible information. You can check that out at extremehealthradio.com/cancer. And if you're interested in products like this, we've got tons of them in our store. So visit our store on our website and you can find out a lot of other products that are just like this. So thank you for listening. Let's get back to this interview. And I wanted to ask you again, Dr. Smith, about the Rife technology. You mentioned the Indigo. Now, is that similar to the GB4000, or is it a separate machine altogether? Or
yeah, it's a separate machine. The GB4000 is kind of like a little standalone Rife, and it has like 871 pre-programmed therapies in there, and then plus it has the expandability. You can make custom programs, and if a new frequency is discovered, you can always add that in. So it's very versatile. The Indigo treats acupuncture points, meridians, chakras, which we call Hamer's work from Germany, the mental emotional state. It does a hormone balance, homotoxicology. Structurally, you can adjust the spine electronically. So it's like a Rife on steroids. I
was just thinking that. Okay, so this is more something that a practitioner would use.
Yes.
Okay, and the GB4000 is something more personal, and you sell that. Is that right?
Correct.
Okay. Now, I wanted to ask you, what is the general price range of the GB4000, if you're able to say that? Yeah,
it's around $2,400, which I think is reasonable, considering what it does. Basically, as the FDA takes good quality nutrients off the market, the only thing you're going to be left with is vibrational medicine to treat your problems.
Wow. So now if someone were to buy the GB4000 from you, would they get a set of instructions and maybe a manual, and how do they, Yeah,
it comes with a manual. It's actually a no-brainer. Okay. You basically push like auto channel and then you punch in the number for the program, and then you push run. And it's pretty much that simple.
Wow. So would someone use that GB4000 for, like an acute illness, or would they just use it on a daily basis?
Well, like I said, it has 871 programs in there. So it covers arthritis, migraines, fatigue, hormone imbalances, dental infection, detox, and a whole list of medical maladies, arthritis, so forth and so on. But it's very effective.
Wow, interesting. Okay, so one more question on this. I'm just fascinated by this machine. If someone were to buy it and they were to treat themselves, let's say they wanted to do it on a daily basis, would they have
too much to do it on a daily basis?
Okay.
Because when you kill the pathogens, the body has to be able to detox the poisons that are spewed out throughout the system. So the advice is never to do it on a daily basis.
Okay, that makes sense. And if they were to treat themselves, however frequently they were, would they sit down maybe in a chair, and would they put their feet on something or their hand in something? How does that work?
Well, if you want to treat the whole body, the unit comes with pads and hand cylinders, and literally it'll treat the whole body simultaneously.
Wow, that is so cool. And for how long do you, I guess it depends.
Each program has different numbers of frequencies. Wow. So, for example, one program may only last 5 minutes, where another program may be a half hour.
Oh, I see. Okay. So you could sit and watch TV or something and do this?
That's what I do. I have mine on my couch upstairs, and I'll watch TV or read a book or whatever.
Okay.
And, to me, it's an inexpensive price to pay for health.
Yeah, no, I agree. And especially like you were saying with, some of the supplements they're, taking away now, God only knows what direction that's going to be headed in. And so I think it's important for people to get, take some proactive steps towards their health. And I think that's a great thing to do. So I wanted to ask you, I know we got a limited amount of time, but what do you make of all this gum disease and receding gums and issues with people's gums these days?
Well, it's a combination of things. The American Dental Association admits that mercury fillings are a source of periodontal disease, because the mercury leaks out 24/7 and it causes a breakdown of the tissue. Nutritionally, there's a lot of problems, and not getting the right nutrients, and the body becomes acidic. It starts to draw minerals out of the bone, and the bone around the teeth is cancellous or spongy, and that's going to be one of the first areas where you get demineralization.
Interesting. So, people have got receding gums. The first thing they need to look at is most likely their diet.
Absolutely. I personally, raw is where it's at. And civilization is the longest running experiment. And nowhere in the history of civilization has there been a tribe that was strictly vegetarian. Not to say that you shouldn't eat that way, but I'm just giving you facts. So I honestly believe that individuals do need a certain amount of animal protein to maintain, the integrity of their immune system and their bones and so forth.
Now, I read recently that there's a correlation between the amount of phosphorus that people eat and their cavities. I believe if their phosphorus went above, I forget what the level was, then it would almost immediately trigger cavities. Have you heard that?
Yeah, if you get too acidic,
then
you enhance the growth of pathogenic bacteria. But Justin, a real sleeper is hypothyroidism. And back in the 20s, Eugene Hertog, who was an MD researcher from Belgium, connected tooth decay with underactive thyroid.
Oh, really?
Sure. And just think about it. You have chlorine in the water, fluoride in the toothpaste and in the water, bromine to bleach the flour products. You have hydrogenated fats. You have heavy metals in the atmosphere when they burn coal for power plants. The bottom line is all these items that I mentioned suppress thyroid activity. Yeah,
it's so crazy. So I wanted to ask you about the the thyroid and the liver. And, most people think, oh, your most important organs are maybe your heart and your brain. And then I've heard a lot of health people talk about your liver being the most important organ. But the thyroid is the master controller of your entire endocrine system. Is that correct? Your hormones and all of that?
Well, the pituitary gland is kind of monitors the biofeedback of the hormones going through the body. But
okay.
I'd have to say that the thyroid is probably next in line to the pituitary, and it governs the metabolism of all the cells of the body. It also governs the function of the heart and your mind. I had a woman hearing voices in her head, and it turned out to be mercury in her thyroid because she worked at a facility that was like a mile away from a power plant. And in 10 days of detoxing the mercury out of the thyroid, the voices stopped in her head. So the thyroid deals with depression, anxiety, panic attacks, digestion problems, hair problems, insomnia, fertility, tooth decay, skin problems. Acne is related to underactive thyroid. Allergies are related to underactive thyroid. So you can see how key the thyroid is in total body metabolism.
And not to mention, weight gain and those types of obvious issues.
Right, and balance of the other hormones. So it's extremely important.
Wow. So, all right. So with the thyroid, I know a lot of people talk about iodine and things like that. So what types of things are good for maintaining good thyroid health?
Well, it is a very nutritional organ, and certain things like manganese is important. Selenium is important. Even testosterone levels, even amongst women, is important to convert the T4 to T3. Okay. The B vitamins and selenium are extremely important. So what I'm finding, it's very frightening. The vaccines, in a high percentage of cases, are being trapped in the thyroid. And I've noticed specifically tetanus is being trapped in the left lobe of the thyroid. So you have childhood vaccines, you have heavy metals coming from the mouth and the environment, you have pesticides, you have other chemicals, dioxin and so forth, and fluoride from toothpaste and water. They're trapped in the thyroid, causing an underactive gland. Now, the thing is, you could throw iodine at it, you can throw thyroid hormone at it, but what I've discovered is that you have to cleanse these toxic substances out of the organ in order for it to function at its maximum potential.
Right, because it makes no sense to, throw nutrients at it when it can't even operate correctly, right? Exactly.
So the key in the diagnosis is delineate or define what's in the thyroid that's causing your problem.
Okay. Now, would the GB4000 help with your thyroid? I'm sure there's frequencies for that.
Oh, definitely. Pathogens, viruses, whatever. Definitely you can do that in frequencies.
Wow. So would you recommend, what kind of iodine would you recommend?
I recommend magnesium iodine. It's biologically much more active. And you could take it orally.
Okay.
Or put it into like an ounce of water.
Now, is that nascent, you said, or?
MAG, nascent, NASCENT.
Okay.
Magnesium iodine.
And do you sell that, or is there a place online that people can get that?
Yeah, we sell it from our ICNR.
Okay. And
the key is you need this to counteract the radiation that's coming over from Fukushima, the radioactive iodine 131.
Yeah, I mean, it's almost like a daily tonic people need, right?
Well, just think about it. Japan has the lowest cancer rate of any country in the world. They also have the highest consumption of iodine. And you're talking like 14 milligrams per day. And in the United States, the RDA for iodine is just enough to prevent goiter. And if you want to read an interesting book, it's called Breast Cancer and Iodine by David Derry. And he showed that the iodine turns on apoptosis, which is the self-destructive mechanism of cancer cells. When you don't have enough iodine in the system, the cancer cells just run rapid.
Oh, wow. That's fascinating. Are there any other, that's one question I wanted to ask you before we leave. What other books would you recommend? I know you've got 3 books, or I think more, and we'll have links to those. But what other books that you haven't written would you recommend people read in terms of the types of things that you're into?
Well, a good friend of mine, Mark Starr, wrote a fantastic book called Hypothyroidism Type 2.
Okay.
And he, did the research and connected the dots. And it links all these different symptoms that were discovered back in the 20s and 30s and 40s. And it'll blow you away once you see the connection.
Wow. Yeah, that's so fascinating. Gosh, I have so many questions. I could talk with you for hours. I wanted to ask you too, before we go, I wanted to ask, I brush my teeth, years ago I stopped using toothpaste, but I brush my teeth now with a combination of baking soda, sea salt, and a little drop of 3% hydrogen peroxide mixed in water. Is that a good solution?
Yeah, that's a good combination. I mean, there's a lot of different things you can do. I got so disgusted with the toothpaste that were out on the market that I developed my own formula called Aqua Essence, and it's free of sodium lauryl sulfate, of antifreeze, of fluoride, of any antibiotics.
Oh, wow.
You could read the ingredients and all. It's basically, we have our own designated website. It's called aquaessencetoothpaste.com. And the feedback has been phenomenal. It's 100% natural, and it really does what it says it does. It helps bleeding gums, and your mouth feels fresh. But from another standpoint, you can also, if you have a water pick device, for example, you could just add some of the magnesium and iodine, like 10 drops, before you go to bed in the water reservoir, flush your mouth out with it. The next morning, your mouth is going to feel squeaky clean.
Wow. Yeah. It's so interesting. When I started learning the connection between your teeth and your health, for so many years, I didn't take care of my teeth, and it was just because it was a hassle and all this kind of stuff. But when I started realizing the connection, now I treat my teeth like gold. I don't want anything to happen to them, and so I brush with this baking soda and all of that, and I think that people need to start understanding the connection between their teeth and their health, and things like cancer and all this other kind of stuff.
Yeah, basically, I say if the teeth were on the top of the head and your hair was in your mouth, most people would be bald.
Yeah, that's a good way to look at it. You mentioned earlier, I know we got to take off here in a couple minutes, but you mentioned earlier about the fluoride in the water, and that's, we could spend an hour just on that, but I just want to give people some simple, solutions. What kind of water filter would you recommend? Do you sell any? And if not, which ones do you recommend?
I don't sell any filters. I have a whole house water filtration system.
Okay.
It's a VM750, and they basically have a separate tank that specifically is devoted to pulling fluoride out of the water. So my whole house is fluoride free, and the other tank pulls out dioxins and pesticides and drugs and things. It's really frightening. The average public water supply has about 66 drugs in a homeopathic form. So they're on the internet, and we have a link. If you go on ICNR.com and the site index, and I don't get any commissions from it, so I don't care. The key is if you scroll down to the end there, water purification systems at the end of the index, you'll see, and it's reasonable because for a family of, let's say, 3 people, the tanks should last anywhere from 5 to 7 years. Wow.
Okay. It's 5 to 7 years for about 3 people. That's pretty cost effective.
Absolutely.
It's these types of things that we all need to start doing that improve our health dramatically, but they don't take any extra effort. It doesn't take me any extra effort to brush with baking soda, salt, or hydrogen peroxide, or use Dr. Smith's toothpaste. It takes no extra effort, but just by doing these little things every day, it makes a huge difference in our health.
Yeah, life is really simple when you come down to the basics. And that's what I stress when I lecture, when I treat. The closer you get to the truth, the more simplistic the solution is. Yeah,
it makes sense. All right, so we're going to wrap up here, but one last question for you. I wanted to ask you, what kinds of things are you working on? Are you working on any new books, or what direction are you headed with your work?
Oh, interesting you should mention. One of the things that we're doing is working with homeopathics. We're finding that to be extremely powerful. And even with cancer, I believe that using a homeopathic forms of certain minerals can prevent the uptake of glucose into the cancer cells and actually starve them to death. So that's the direction that we're working with now.
Wow, and that's based off of all your research you've done with the book that you wrote on cancer and everything like that.
Correct.
Wow, fascinating, Doctor. Would you mind staying as I close after I close out the show?
No problem.
Okay, thank you. Okay, thank you so much, everybody, for joining us today on Extreme Health Radio. You can find, again, the show notes with all of these links and websites and all this information that the doctor mentioned at extremehealthradio.com/17. So thank you again so much for joining us. And if you found value in this episode, would you do me a huge favor? I would really, really appreciate it. Could you click like on this show page and follow us on Facebook and Twitter and those types of social media outlets? And if you found value also, please send this show to your friends and family members who may be dealing with chronic tooth issues. Because there is hope out there, and I think it's important that people understand that. So if you would do that for me, I would be greatly, greatly appreciative. And we're also 100% listener supported, so your donations are graciously appreciated and accepted, and we would be honored if you would donate any amount you would like. If you can do that. If not, that's okay too. We've got a full store, so check out our store. We've got all kinds of great and amazing products for you in our store, so make sure to check that out. So again, thank you for joining us, and I hope